This is less than last week, but this is because there is evidence that more normal NHS activity is starting to increase. There are 581 people with confirmed coronavirus in hospital today, and a further 298 suspected cases. This is lower than last week, and the lowest number of COVID-related hospital patients since the beginning of April. But this is still the equivalent of 3 of our hospitals full of people with coronavirus in Wales. There are 385 available critical care beds in Wales, including our surge capacity. Around 67% are empty and available for use. 66 people are being treated in critical care capacity for coronavirus. This is lower than last week and more than 60% lower than the peak we saw in April. Over 3,100 people have been discharged from hospital, but most people who have had coronavirus will have stayed at home. Since the start of the pandemic, we have been clear that the NHS remains open and available to people who need emergency and urgent care and treatment. You will remember we took the early decision to suspend planned appointments and surgery to help the health service prepare. We have seen an overall reduction in the number of people seeking treatment, particularly for emergency care. 10% fewer people are being transported to hospital by ambulance. Daily attendances to emergency departments have reduced by around a third, and emergency admissions to hospital have also fallen by a third in the initial COVID period. We are, however, starting to see signs during May of activity returning closer to the usual levels for this time of year, but I would encourage people to seek emergency healthcare when they need it. We've also been worried about a reduction in the number of cancer referrals during this period. The number of people added to the waiting list is twice the level just from 3 weeks ago, but in overall terms, the number remains lower than in previous years. We have published our COVID-19 operating framework for the NHS, which sets out how we will begin to restore normal activity for the NHS. But I also want to recognise the importance of non-hospital settings, where a huge amount of care is and continues to be provided. Community nurses continue to see patients in their own homes, whatever the diagnosis, to meet patient needs. Coronavirus has not removed the need for people to be cared for at home. We have seen up to a 25% reduction in GP practice activity, but GPs and their local teams have remained a critical part of community support and transformed their services to ensure safe contact with patients. As an example, the National Video Consultation Service is supporting remote care home consultations, and each of the 64 primary care clusters are working collaboratively to examine people with coronavirus symptoms, in many cases using a hub model across different practices. We want people to continue to order their prescriptions. There is no need to request additional supplies, but you should allow more time for this process and order 7 days in advance. Community pharmacy services have been maintained throughout the pandemic, often in the face of significantly increased demand for prescriptions. And pharmacies have been a vital source of support for people's health in their local communities. They dispensed 7 million prescriptions in March, and some have reported the number of prescriptions dispensed at the end of March and the beginning of April, increasing by as much as 50% on the same period last year. We've been working with military planners, private, public and third sector organisations, including the British Red Cross, to draw upon the many people across Wales who volunteered their time. And we're also working with Royal Mail to allow community pharmacies to post prescriptions where there is no other alternative available during this difficult time. We had to suspend routine dental work at the start of the pandemic, but if people need urgent dental care, they should call their dental practice or 111. Urgent treatment which cannot be carried out in a practice will be provided in one of 15 emergency dental centres we have established across Wales. And since routine dental treatment was suspended, face-to-face treatment has been provided for 5,400 patients. We also needed to suspend routine eye health checks, but if people need urgent eye care, they can still telephone their local practice and book an appointment with an optometrist. Rehabilitation will be a critical part of all health and care services, including for people recovering from coronavirus. And you'll be aware that the Health Minister has announced £10 million for local boards to increase capacity in community-based services. Finally, this week marked International Nurses Day. And I would like to use the opportunity to pass on my thanks to all of our nursing and midwifery staff across Wales. This pandemic response has highlighted the critical nurse that nurses play alongside all our healthcare workers and staff. And I would also like to thank all of our fantastic staff for their care and their ongoing commitment to the Welsh population. Please continue to support our NHS and care system by following our advice to stay at home. If you do go out, please stay local. By staying at home in these difficult times, you continue to protect the NHS. Thank you. Diolch yn fawr. And I'm now happy to take questions that we have remotely. And joining us just to start with Stefan Messenger from BBC Wales. Good afternoon, Stefan.
Thanks, Dr. Goodall. How significant a development is the news that Public Health England has approved an antibody test, and what will the process be now in terms of accessing that potentially for Wales? Will, for instance, the UK government be acquiring those on our behalf? What can you tell us about those discussions if they've begun?
Well, clearly the development of an antibody test would represent a very positive development in our approach to a testing regime. It would be supporting the test, trace and protect strategy and the plan that the Minister was able to announce during yesterday. We are plugged into those UK discussions at this stage. I think while there is an announcement that has been made, I know on an informal basis, as you would expect, first of all, there is a need to check and validate any testing regime to make sure that the accuracy is there that is necessary. And secondly, there would need to be a commercial arrangement in place to deploy that. But I know that I have officials who are involved in some of those UK discussions later on this afternoon, and I'm sure that there will be an announcement about this positive development and its implications in due course.
Thank you. And secondly, as lockdown restrictions are eased at varying rates, of course, across the UK, there does nevertheless seem to have been a marked change in tone in recent days in terms of the response to the pandemic, much more of a focus on economic recovery, getting people back to work and so on. I wonder how worried you are about a potential second wave of infections and how likely that is.
So I think, first of all, as I've shared in these press conferences over recent weeks, it's important to recognise that the preparation that was put in place, but also the public response to maintain and comply with the lockdown criteria has been a really important part of mitigating the peak that we were expecting. But on our analysis, we remain really concerned that although currently we are taking a very modest and cautious approach to exiting some of those lockdown measures, there is still real potential to see some of the community transmission rates increase further. And there are potential opportunities to see that this virus could rise to another peak alongside some of those measures. It's why that is being very carefully coordinated at this time, why we're using the modelling and also why we are retaining our preparations as much as possible. So I'm hoping that with the 21-day period in place for the review of our lockdown measures and how they work in Wales, the fact that we are going to be looking at a number of critical measures from community transmission, the R rate, right through to the impact on our hospitals, that we will be able to keep this under control. And equally, if we have to make some steps backwards, I'm sure that the First Minister and the Cabinet would be making those types of decisions as well. However, as I've outlined, it's quite clear that at least we are through that initial peak, and I would hope that we can continue to deploy mitigating actions if there was going to be either a second or even a third peak in the future. Okay, thank you very much, Stefan. I appreciate those questions. I'd just like to introduce James CrichtonSmith from ITV Wales.
Thank you, Dr. Goodall. I'm just finding the mute button there. This test that's been announced today is reported to be 100% accurate. Will Wales get this specific test, and when would you like to see it being rolled out across the country?
So I can't comment on the validation. Obviously, we have professional experts across the UK, including our public health agencies, who will be part in terms of validating that at this stage. But as I'd already referenced, the test, trace and protect approach that we issued yesterday means that there is an important role and contribution to be made by antibody testing, whilst we're able to expand and increase the number of antigen tests. Knowing that someone has the virus on a particular day is very different from knowing whether an individual has had the virus at all. And clearly we are able to have some sense of what we think the community transmission rates have been more broadly. I think we also, however, just need to ensure that people don't feel that we're yet able to describe about immunity. I think that is one of the outstanding tests at this stage, but my hope would be that using those UK negotiations, that we are plugged into those scientific discussions, that we would be able to broker the equitable access that we need, and hopefully we can take advantage of a UK deal in place for that if it comes through.
Elsewhere, talking about the knock-on impacts, the long-term impacts of COVID-19, are you confident that you have enough people, particularly do you have enough physiotherapists to help those people coming out of COVID-19 and recovering from it?
Yeah, I think it's important to recognise that our workforce, James, has had to adapt and change in many different ways, and certainly the way in which we've seen our workforce respond to the very immediate operational response has meant for many professionals using their skills and experiences but working outside of their normal work environments. And clearly one of our approaches as we try to get the NHS heading for a level of normal activity, if I can speak openly, is not about us just flicking a switch. I think we're going to have to take a very progressive approach to this going forward. Certainly, we need to ensure that we're taking maximum advantage of those that are able to operate in our community environments. I think some of this is about that upfront support in areas like physiotherapy while somebody's going through their hospital stay. But a lot of this, I think, is going to be about ensuring that we can wrap around some of the community support working with GP practices. And of course, our community-based services run from the health boards as well. So we're going to keep the workforce model under review. If we are developing our ongoing work and commissioning of the field hospital beds, then hopefully we would also be able to make sure that there are individuals who benefit from allocating them to some of those community-based facilities as well. But I think it's a good question, and we will be keeping that workforce model under review. Okay, thank you very much, James. Just going to move to Mike Hughes at Global.
Thank you, Dr. Goodall. You've talked about the concern that you have on the number of people in Wales who have not taken up, say, a cancer screening recently, and the fall in numbers in A&E, for example. How concerned are you across the whole of the NHS that people missing things like cancer screenings, etc., could see the number of indirect deaths eventually surpass the number of those who have sadly died directly from COVID-19?
I think in developing our response, we've always tried to look at harm through different lenses. When I issued the NHS operating framework for COVID-19, this wish to restore a level of our NHS activity really wanted to be clear about 4 different harms I think we're trying to respond to at the moment. The first is about the harm that would be caused by the COVID-19 virus in itself and making sure that we were in a position to support those patients. The second was making sure that our health and care system was not overwhelmed by too many patients and a greater demand that we were able to accommodate. The third harm is actually in the arena that you're describing about people not seeing normal levels of activity. And the fourth harm is actually something broader about the economic impact and impact on society more broadly, and knowing that communities would be affected. So I think we've been very clear throughout these recent weeks that we want people to access the NHS and the care system, that we are open for business, but we have been quite concerned about some of those numbers. So positively, having seen a larger reduction in our cancer referrals, I was able to see that our operational data was showing that there were more cancer patients now coming through on our waiting lists. I think that is a sign of some recovery on that. Hopefully that is both people responding, but also using our clinical teams to refer it. And perhaps I can extend that out as well. We have, during the early part of May, just started to see some recovery towards more normal levels of activity in both our emergency admissions and our A&E tendencies. So we just need to give the message that if people need to access the services, we will try to accommodate them as safely as possible, but there are also still alternative services that people can access when needed.
Thank you very much indeed. Wales is not a healthy nation, some of the worst obesity rates in Western Europe. Everyone appreciates, obviously, the pressure that the health service has been under and is still under at the moment. But could the NHS use this pandemic as an opportunity to get people looking after themselves more, taking better care of their physical health and giving them the best chance to fight off any future illness going forward?
So we've always been concerned about our starting point, recognising that we will have particular characteristics around our population in Wales. We tend to have a higher level of reported underlying health conditions, for example, for our population. We have a higher level of older people, for example, that we need to do. But I do think it's possible, even in these very difficult circumstances, to try and get out some of our messages around general health. I think one of the reasons that is driving the expansion of the opportunity to do exercise is actually to reinforce that. That's a decision that the First Minister and the Cabinet have made in Wales. I think there's also a chance to recognise that not all of this is about physical health. I think we also need to make sure that we're focusing on the emotional health and well-being of our population and of course patients who are accessing our system. But I would hope, and I've seen more people perhaps than normal exercising themselves on a local basis, that perhaps we're able to retain some of that to the future and we can work with the population to look after their own health. Obviously we're moving to a bit of a different phase at this stage, and I do think those healthy messages are going to be really important for the forthcoming months to get people as fit and healthy as possible. Okay, thank you very much. Just going to move to Mark Smith from Wales Online. Good afternoon, Mark.
Good afternoon, Dr. Goodall. Betsy Goodall at the University Health Board is now starting to see a spike in cases of COVID-19. Do you believe there is a link between these cases and those being seen in the northwest of England at the moment? And what is being done to help patients in this region of Wales?
So I think there's a couple of things that we will be observing across Wales more generally, and this will be something perhaps that is visible within North Wales. First of all, we've always said that the virus will inevitably travel in different ways. The general flow that we've been seeing in Wales is sort of west to east, south to north. So there is something about the fact that we will see variation across Wales at different stages. I think we also need to recognise that we've been looking to increase and targeting testing. So to some extent, we may have seen some rise in some of the positive cases reported. As an example, an outcome of some of the recent changes in care home guidance, and seeing that therefore we are testing care homes across Wales, but that will include in North Wales. That might actually highlight that there are individuals again who have tested positive. I think the important thing for me is keeping an eye on the overall numbers. So what is the R value? What are hospital admission numbers telling us at this stage? But as I recall looking at our operational data this week, I think our North Wales hospitals in critical care, for example, were still reporting that their numbers of patients in intensive care unit beds were actually less than the peak, which was probably 2 or 3 weeks or so ago. So I think you have to look at the combination of all of those areas, but also understand that sometimes the expansion of testing regimes can also be a contributory factor.
Thank you. And secondly, I understand that a new clinical pathway is being developed, which will allow people to be treated at home with oxygen machines, meaning that they won't have to go into hospital or indeed intensive care. Could you offer more detail on how far along this pathway is and its development in the Welsh NHS, and how it will work in practice?
Yeah, I think we're having to continue to learn clinically and practically about this virus and the nature of the response that we need to support and broker. I know that we are plugged into Wales into various research studies which are trying to analyse the interventions that can take place at different parts of the pathway. Certainly what we do know is that for those that end up in the hospital environment, they will be very ill indeed, and obviously those that end up in a critical care unit, they will be in a very difficult and even life-threatening situation. So we do need to make sure that the support is there. But I think your focus on respiratory pathways, given the nature of this disease, is really important, and we do need to ensure that we have alternative community pathways and can give support to some of the assessment that has been done in primary care. So as an example, the development of CPAP machines in Wales, whilst on the one hand they are used in a hospital context, actually there is a level of support that can be provided from that, as well as general oxygen supply within the community environment. So as I said, we're learning and having to adapt in very quick and unusual circumstances, but we'll take advice on the evidence, and if we can even lead the way with some of those arrangements in Wales, we'll look to do so. Okay, thank you very much, Mark. Just moving across now to Rod Minchin from PA. Rod, good afternoon.
Good afternoon. Good afternoon, Dr. Goodall. The NHS has coped with the peak of coronavirus infections, but to free up capacity, many non-urgent procedures have been cancelled. GPs this morning, giving evidence at the Cynhadledd committee, said that many patients that they saw were scared to visit their GP or hospital. When will the NHS begin to look normal again?
As I outlined to a couple of other responses, I think we need to recognise that this is going to have to be a cautious, progressive approach. There are a number of treatments and interventions that we had always authorised throughout this pandemic. We needed to recognise that obviously emergency and urgent care carries on whether there is a virus around us or not. And I would want to make sure that the NHS makes the appropriate steps further forward. But I think we are moving to a phase where we have to balance the responsibilities of responding to the virus alongside the responsibilities to make sure that people who need care and treatment can can access it. So I don't think it's a switch that we can just press. I think we are going to need to review how we roll this out. I've got formal plans coming from all of the health organisations in Wales by Monday, just outlining how they would wish to take that through locally. But I'm also pleased to say that a lot of that is actually about our health boards cooperating with each other at this stage. But in terms of the feedback from the committee session this morning, I would share some of the similar concerns. I think whilst in the early stages of our response, the fact that the public stayed away from accessing some of our services actually really did help us with our preparation. This was a really important phase in responding to a fast-moving environment. But actually, we now need to look after those areas, and I remain concerned that our A&E attendances, our emergency admissions, our referrals are still lower than we would expect at the moment.
Okay, thank you. My second question is that this morning, newspaper wraparounds from the UK government with the message "Stay alert" have appeared on newspapers in Wales, which contradicts the Welsh Government's stay-at-home advice. How helpful was that, do you think?
I mean, clearly, if there are changes around communication approaches, that has the potential to cause confusion. But I think we've been very clear about our stance in Wales. The First Minister was very clear when he was announcing the review of the lockdown measures in Wales just last Friday. Where we are, and certainly given the R value that we see as prevalent in our community, we want to take modest and cautious steps forward. We want to review the impact of those measures. And our message still is very clear. If people stay at home, they help to protect the NHS, and they will help us to continue to focus on saving lives. And that is our core responsibility at this stage. Okay, thank you very much, Rod. Now going to move on to Tom McNab from Carers World Radio. Good
afternoon, Dr. Goodall, and thank you very much for taking my questions. The first one refers to submissions to the House of Commons Select Committee on Health and Social Care. And part of those submissions refers to COVID-19 having exposed pre-existing weaknesses in the NHS. So is your message about taking this cautiously really covering the fact that the system was already weak to start with?
I think the NHS represents a really fast-moving environment. We have a tremendous ability to care and treat for people at scale, in the millions, across Wales as well as across the UK. And inevitably, the pace of technology changing, the pace of clinical practice changing is something that we have to keep up with. So I think the NHS has changed dramatically, even in the 30 years or so that I've been working in it at the moment. Clearly, it's a system that works under pressure in all of the different settings that happen. And I think that's why we had to take some really important steps in our preparation, that because we know that the system works at pressure, we had to give some flexibility in the time. So inevitably, even in the middle of a crisis, there is learning to be adapted. And we have already had various commitments over recent weeks about continuing to develop, for example, the workforce and the staff that we need. And just to give you some reassurance, Tom, we are still pursuing some of our normal mechanisms. We are still looking to expand, nurse placements for the future, to expand around various ranges of our healthcare professional staff to make sure that we continue to grow the workforce in Wales and don't just stay still.
Without wishing to sort of dampen what seems to me to be an optimistic picture, those same submissions to the Select Committee refer to the NHS not getting back to some form of normality for months, and that's coming from the NHS itself in other parts of the country. What's your view on that?
Well, I think I'm in agreement that we are not going to see all work and activity translate as normal. And I think there are two takes around that. I think one is that we're going to have to recognise that working through this virus, we are going to have to catch up on a backlog of patients that will still need to be treated. Whilst we'll put a focus, I think, on urgent patients, for example, inevitably there will be a knock-on effect on others. The other comment I would make, though, is that there has been incredible transformation occurring over these recent weeks. The way in which teams have worked differently, the use of technology in different ways. And I guess sometimes we've really been turning upside down our normal assumptions about how the NHS operates. And I would really hope that we can hold on to those changes in practice, because I think they are about safety, but I think they are also effective for both staff and our patients when they're accessing our services. Okay, thank you very much, Tom. I have a final question from Andrew Nettle from The Leader.
Hello. So some of our readers who live up in North Wales and Flintshire have been concerned the last day, mainly because of the release from Public Health Wales yesterday that showed there was a rather large spike in the case of coronavirus identified here in the last 24 hours. and there were 39 cases identified yesterday. So I don't know whether you're able to shed any light on sort of the reasons behind why that spike may have occurred, whether it's to do with testing or anything like that, and just provide the public with a bit of reassurance over those figures that it may not be something to be as concerned about as they appear at face value.
Thank you, Andrew. So if you'll allow me to speak generally rather than perhaps specifically, I think it's still clear to us that we're still going to see some variation across Wales in different areas, sometimes on days, sometimes that's about catching up with test results that are coming in, sometimes it may be because of an intervention took place. So as an example that I gave earlier, if a care home has been particularly supported and there is a testing regime taking place, you will obviously see that convert into potentially results that are going to be reported within a particular community or a population because it's associated with a care home. I think equally, at a time when we're looking to increase the testing usage across Wales, we may see different areas, and I'm mindful, of course, that in the North Wales context, obviously the drive-through centre has opened in Llandudno, which actually gives a broader access to tests, particularly around healthcare and key workers at this stage as well. So I think there's probably a number of factors that will contribute that at this stage. What I can reassure you about is that we'll keep ongoing monitoring of that situation. I think our message remains. This is why we want people to understand that it's really important to maintain those lower levels of community transmission, and that we do want the population of North Wales to help us to protect the NHS and to stay at home.
Thank you. So as a follow-up, we're having people as well express concerns about just generally going into hospitals, again, due to these sort of high case sort of peaks that we're seeing in North Wales. And people are also just wanting not to put any additional pressure on the NHS while they cope with this pandemic. These are people that don't have coronavirus symptoms or even just coronavirus cases confirmed. They're just general basic needs or any other business essentially that are staying away, and it's possibly doing more harm than good if they don't get them seen to at all. So I don't know whether you're able to reinforce that line of the NHS being sort of open for business across all sectors and give, and again, some more reassurance that people are there to help.
Yeah, as I said, Andrew, I've been really grateful that in those early weeks, the public really worked alongside us, and making judgments to step away from our services was fundamental to helping with the preparation that we're able to put into the system. But we do want people to know that the NHS is open for business, that we are taking precautions for patients who are accessing our services. It's important to know that people attending emergency departments, that we have mechanisms to be able to segregate patients, for example, as you would expect and require. We will also want to make sure, though, that people understand that they can also access alternative services than just a hospital environment at this stage. But whatever the setting is, any of our healthcare staff are trying to do that in the safest way possible. So if you have a need, you should be accessing the care and treatment that you need, and we'll do everything that we can to support the Welsh population. Okay, thank you very much, Andrew, and thank you everybody for your questions.